Hi class, I'm Christal Kuehler and I've chosen to do my presentation over the Adlerian therapy, which was introduced to us by Alfred Adler. And he was a world-renowned philosopher and psychiatrist, and he studied people in a larger social system. Adler believed that all people have one basic desire and goal. That's to belong and to feel important. And he also believed that when a person is encouraged versus discouraged, they're more able to accomplish their goals. They feel more appreciated. They're more cooperative. Those people who have been discouraged in their earlier years are more likely to be more withdrawn and give up and act out in unhealthy ways. He believes that we begin developing a lifestyle choice and view before the age of 6. And he also studied superiority between men and women. Both men and women strive to be superior, and they both want to be perfect. We all, as human beings, strive to be the best that we can be. And Adler's view was that all individuals should desire to be superior and to do the best that they can possibly do. Something I also learned about Adler that I did not know was he supported women's rights. He felt that women, along with men, should be in the fight for superiority, that we should not back down because we are women. We're both equal, regardless of our sex. And he defined emotionally healthy to be to have a development in a social interest, to extend our desire to be socially interactive with more than just our immediate family, to have interaction with other similar cultural groups. And there has been very little research done on the Adlerian therapy in comparison to other theories. The Adlerians actively seek other theories to integrate into their work, such as narrative and other constructive therapies. The book states that Gestalt and Adlerian therapies both benefit much to one another, and also brief cognitive and behavioral therapies fit with Adlerian therapy. The parents of Adlerian therapy groups have been proven to become less authoritarian and more tolerant to the different behaviors of their children. The Adlerian therapy group has helped them to learn skills that bettered their parent-child relations. The positive feedback that the parents receive from the Adlerian theory has benefited their relationship with their children time and time again. And furthermore, Adlerians encourage all their patients and correcting their faulty perceptions and mistakes. In return, patients learn to cooperate with others, and they learn to contribute to society in many different ways. The Adlerian therapy is very much involved with child guidance centers and group and marriage counseling. Has always have been more concerned with improving society than with the ownership of Adlerian therapy. And last but not least, the openness to use other theoretical perspectives and not being set on one specific idea is the significant characteristic of the Adlerian therapy. And the number one reason I find this ideal as an ideal choice for therapy for all different types of people. It is the solution to many different problems. And I will say this in closing, that there are multiple different therapy routes that benefit many different people. And this is the therapy that happens to fit my perspective to help.